Hi everyone, in this video I'd like to touch upon an interesting topic. Why are more and more doctors quitting medicine, either completely or going part-time or taking career breaks, etc. So I'm going to give you a little bit of a European perspective because I'm a European doctor. So I've done my medical school and residency training in Romania. I've worked a little bit in France, and then at the moment I'm working in the United Kingdom. So basically I have a bit of a continental wide perspective, let's say, on why doctors may want to quit. I'm not suggesting that quitting is the right thing to do. For many doctors, I think it's not, but it may be because some people are just burnt out. They need a break. They can't handle it anymore. And two of the reasons that I've heard mentioned before that why doctors might quit would be lack of adequate pay and overwork. And I think that's a very, very broad simplification because there are many reasons why people might want to quit medicine after investing years of their time to study, to train, to become good at their jobs. And medicine is, to some extent, still a fantastic profession. It does give you the opportunity to actually, and the privilege, let's say, it's not an opportunity, it's a privilege to be involved in your patients' lives, to change their lives for the better, to help them in times of need, in times of struggle, to assist them in their, most difficult moments. So I think that's something that, you can't have in many other professions, and that's something fantastic. However, the medicine we do today has changed completely. So if you look at the old school doctors from 20 years ago, 30 years ago, 50 years ago, medicine was a completely different profession at that time. Nowadays, many doctors actually feel that they're just a cog in the system, that they do a specific role. They are, the clinical fellow, they are the consultant in this very small subspecialty, and they do not feel comfortable branching out and doing other things because of regulation, because of expectations from people around them, because of pressures from the health system, hospital management, etc. And it's very unfortunate that, sometimes administrative duties, admin work, as we call it, takes up more time than actual time spent with patients. And that's a very, very big problem. I can tell you very honestly that there are clinics in which myself as a pulmonologist, so a respiratory physician, I don't even use my stethoscope anymore. I don't listen to a patient's chest because the consultation time that's given to me, the allotted 20 minutes, only allow me to explain briefly to my patient what his CT scan might show, what his x-rays looking like, what his blood test results have shown, what we might do next. And I don't have any more time to actually do a proper physical exam, to actually maybe ask them, how's the rest of your family? How are your kids? What are you doing, for hobbies? Because these are questions that I think a doctor should ask, should have time to ask. You should be given time to build rapport with your patients because this builds trust. And in the end, trust is a very, very important thing in the patient-doctor relationship. In no particular order, I'm just going to add a couple more reasons why I think many doctors choose to quit as well. So one thing that's maybe a little bit unexpected is the lack of career progression. And you may say, well, but you're a doctor. Why do you need to progress your career? And that's one thing. And the other thing would be, yes, but doctors always go to conferences. They always learn new things. Yes, but in the end, the role stays the same. And the feeling that I've mentioned before, that you're a cog in the system, that you're doing robotic tasks every day and not really being engaged with your patients, can really become overbearing. And medicine is one of these professions where you constantly need to be on the cutting edge. You need to be learning all the time. So going to conferences, going to courses, that's all good. But sometimes you don't feel like you can, go the next step. Most doctors do not get the opportunity to work in management. So there are doctors who have had maybe 30 years of clinical experience and they still do the same job they've been doing before. They're just seeing X number of patients per day, writing X number of patient letters per day, and that's it. And that's the job. And it becomes a routine. It becomes something that's not really going anywhere. And this may be more acute or less acute depending on the specialty you are in. Also, it may depend on each doctor's personality because some doctors may be more driven to do more, but they run into this sort of ceiling where they cannot really go forward without becoming, involved politically maybe, and being a little bit sneaky to get ahead. And I think that really creates an atmosphere of tension between doctors. So I think the lack of career progression is something that's not really acknowledged in the medical profession. And here I'd also like to add maybe a comment about the pay that you receive, the salary you receive as a doctor, because in Europe at least, generally the salaries for doctors are capped. There is a national scale, pay scale, and you get paid according to your experience based on that pay scale. So you know exactly how much money you'll make. It's very rare that a doctor will exceed that by very much. Even if they do a lot of extra hours, they cannot really break through sort of a ceiling of pay, which is maybe a little bit different compared to America. I mean, there are doctors in Europe who do private work as well. And depending on the country in Europe, private work can be more or less lucrative. So that's also something that depends from country to country. But generally, you are forced sort of to choose between either being a private doctor, consultant, specialist, or working in the public health system. In the public health system, the pay is capped. In the private care system, the payment is not capped, but there's only so many patients you can see in a day. So many procedures you can do. So obviously you get to this stage where you cannot really go any further. And of course, salaries in Europe are nowhere near the salaries in the United States, for example. But regardless, I cannot say that pay is the main reason why doctors would want to quit medicine, because you are well paid. Generally, even in Europe, in most countries in Europe, you are well compensated for your work. But another thing I can add here is the fact that there is a lack of flexibility in the medical profession. So, I'm a guy. So for example, for me, it's a lot easier as a man. But if you're a woman working in medicine, things are a lot harder for you. Because getting flexibility, for example, for building a family, taking maternity leave, that is difficult. You always feel like you have this choice between becoming a mother and becoming a career doctor. So it's a little bit of a game where you have to weigh what your preferences are and make a choice. And I think that's not fair, because I think there should be more flexibility if you want to maybe go part-time for a little bit, then go full-time. But that's very, very difficult with the contracts that we have at the moment. And of course, in some countries, for example, in the UK, it's quite easy to work flexibly. But in other countries in Europe, you either work full-time or part-time or none at all. You cannot go and work for 3 days a week. You are not sort of appreciated for putting in 3 days a week of your time. There is a lack of legislative flexibility around that. And I think that's a big problem. So more flexible hours and adapting to really the rest of the world would be great, but unfortunately it doesn't happen. And I think that's because public health systems in Europe, for example, are run to the breaking point. So basically, because of the limits on spending and other things, you cannot really hire more than you need. So basically, a hospital will always be staffed to the minimum possible level. So what happens if one of your doctors, one of your soldiers, let's say, falls ill? Then all the other doctors have to pick up all the work. And it's not a resilient system. So if you read, for example, books by Nassim Taleb, who speaks about, anti-fragile systems, building resilience, we don't have that in medicine. So staffing is at a minimum all the time. But in my opinion, I think your workload should never be 100%. It should be somewhere around 80%. So you have a little bit of free time to cover one of your colleagues who's ill, for example. Or if something happens in the hospital, there's a major emergency in your city and all the staff needs to be pulled there, other services do not suffer. But this is something that's very hard to explain nowadays, and everything is run as a business, when medicine is a little bit different compared to a business. You cannot really run it as a 9-to-5 job. And that's unfortunately the way it is, but it's something that's very hard to understand. One of the reasons doctors sometimes choose to leave medicine altogether is because they were involved in a lawsuit. So this is something that's very, very stressful. So if a mistake happens in medicine, especially in today's world, generally there will be a lot of bad press around that doctor, and if they're not protected in any way by the hospital, or they will be sued, they will have to, have the appropriate insurance to cover costs of lawsuits, etc. And that can be a very, very stressful time for a doctor. And, mistakes can happen in any system. But if you create a lawsuit in that sense, that doctor will be so stressed that they will not be able to work probably around the time of the lawsuit. So basically, in a system that's run at breaking point, taking one of the doctors out with this sort of stress really breaks the system. And it's something that's not really discussed. Now, luckily in Europe, it's a less litigious society compared to the United States, for example. And I think that's a good thing, but it's something that's changing constantly. So even in Europe now, there's more and more demands on presenting yourself in a perfect way. If there is such a perfect way, I don't think there is. But sometimes there is this general vibe that doctors should behave in a specific way, and everyone has different definitions of what that is. It depends. Some patients like the doctor who's a little bit more rough or makes a little bit of, a joke that's a bit inappropriate. Other patients hate that completely. Other patients want the doctor who is there at your service and agrees with you all the time. So it's very hard to please anyone because we're working with people. So one of the greatest challenges in medicine is trying to adapt to the different preferences of your patients. And that's something that can be hard for some doctors. Another thing I'd like to mention is the fact that in medicine, as a doctor, you always have to prove yourself. So this is something that can become really, really tiring. Especially as the years go by, you've been working, gaining experience, becoming better and better. You may have a lot of common sense about what is good and what is bad. You still always have to prove yourself to people who may not even be doctors. One such example would be the fact that most doctors in most European countries have to show that they have done each year a certain number of continuous medical education points. They have gained these points, and these are gained usually by spending time in conferences, attending courses, doing online little modules, and generally 1 hour means 1 point. This is something that can be very variable because you can sometimes attend a very bad quality conference, but you still get 20 points for attending that conference, whereas someone who has spent 20 hours reading textbooks and journal articles may actually be much smarter than that person who attended the poor quality conference. So there are all these rules where you need to prove yourself in circumstances that are not always fair. And another thing would be that in medicine, exams never end. So if you think that you're set, that you've become a specialist and now it's all over and it's all good, it's not the case. So, for example, usually when you want to change your profession slightly, you want to go, for example, and work abroad, you want to work in a different country. If you're in the European Union, it's simple because everything is recognized. But if you want to move, for example, from France to the UK at the moment, things are a little bit more complicated because the UK is no longer part of the European Union. Or if you want to work on a different continent. So, for example, you may be a doctor with 20 years of experience in Europe, and you want to go and work in the United States because, for example, your partner, maybe a member of your family is moving there and you want to join them. That's very, very difficult because you need to make sure that you have everything validated. And it's something that's a little bit absurd to some extent, especially for doctors who have a lot of experience. And I understand the need to protect the public from bad doctors. I'm all for that, but sometimes it can be exaggerated. So in my opinion, these are a few reasons why doctors sometimes want to quit medicine. And it's not an exhaustive list because there can be other things as well. So some doctors may just feel fed up. They may want to genuinely do something else for a while. And that's absolutely fine. And I think doctors should be allowed to take career breaks. They should be allowed to go part-time. They should be allowed to, for example, work 4 hours a week instead of 5, if that's what they choose. Maybe they want to spend more time with their family. I think the system should be flexible enough to allow for these things to happen, to have a more flexible workforce in medicine, to be able to be less of a cog in the system, to be able to fill different roles in the hospital if you so choose. And I think that can only be achieved if systems are not run to breaking point. Anyways, thank you very much for watching, and I hope the points that I mentioned were somewhat good for you. All the best to you.